Let me now move to the third part of the presentation and looking at how offender assessment has changed over time. We have first generation, unstructured clinical, moving to second, third, and this is where we first see the LSIR, and going to fourth generation where we find the LS-CMI. The research on first-generation risk assessment clearly indicates that in terms of predictive accuracy, you are not much better off than flipping a coin. When you compare it to second to fourth generation, the clinical first generation is all around the 0 mark, 0.03, 0.05. Now, what about second generation risk scales? Let me give you an example of what they look like. We have the salient factor score in the United States, the SIR in Canada, and we have one in England. Now, there's just two things I want to point out here. One is that these second generation risk scales tend to be relatively short. You know, the SIR has, I think, around 15 items. They don't have a whole lot of items. And by far, most of the items are static. They're unchangeable. You cannot do anything about it. Now, the point here is that these second generation risk scales do predict criminal behavior, and they predict it quite well. However, if you're a practitioner, a parole officer, a probation officer, the only information it really gives you is, oh, he or she is high risk or medium or low risk, but doesn't give you any information on how do I reduce the risk of this individual. Well, maybe in the Canadian SIR score, the only guideline for treatment is to find the person a job, get him married, and have him go out and adopt 5 or 6 kids. That's the limit of what it can do to inform treatment. Third generation, we come to the LSIR, Level of Service Inventory Revise. Now you'll see most of the Central 8 risk need factors reflected in the LSIR. It's not there completely 100%, but most of it is there. The LSIR was the first risk need assessment instrument to integrate both risk assessment and criminogenic needs. Around the same time, there was another instrument, the Wisconsin Risk Classification Instrument, but they had 2 separate scales, one a static risk scale and a second need scale. And there are advantages to this kind of intervention. You have all the information you need in one document that helps you assess criminogenic needs. 2/3 of the items in the LSIR are dynamic, and changes in scores have been shown to relate to recidivism. So if 1 year later an LSIR score goes up, higher risk, you know that whatever you're doing is not the right thing. The person is becoming worse. And if the scores are going down after a year, that's great. Whatever you're doing, you're on the right path. Keep going. So it has the advantage of not only identifying treatment goals, but monitoring progress during supervision. Fourth generation. How do we get to this? How do we get to the level of service case management inventory? We did a study in the province of Manitoba, which is in the center of Canada, where 62 probation officers from the province of Manitoba had agreed to have us audio record their supervision session. So I thank those probation officers because it is not easy to open up what you do behind closed doors to outside researchers. So when we looked at the audio recordings, what do we find? Well, probation officers were very good at dealing with family, marital, substance abuse issues. You see them coming up in their recordings. But if the problem was around your friends or your attitudes, they just weren't there. So we felt that in the province, they were doing their risk-need assessment, and almost it appeared like filing them away and then going into their supervision sessions, forgetting about what they assessed and what they need to be talking about. And that's one of the products that came out of this research. So you look at the LS-CMI, yes, we added more information, but more importantly, we introduced a case management plan and a progress record within the same document, which made it more difficult for a probation and parole officer to lose sight of what was relevant with that offender. You'll also notice with the LS-CMI, we now completely matched up the subcomponents of Section 1 with the Central 8. So we tied it in much more closely with the theoretical underpinnings. The research with the adult versions of the level of service instruments, and I would like to note for listeners, there is also a youth version of the level of service instruments. And there's a youth level case management instrument that I would encourage you who are working with youth to take a look at that instrument. And there is a great deal of research on this instrument and its predictive validity and its usefulness for practitioners. But for this webinar, I am just staying with the adult versions. Research with the LS is the most widely researched risk needs instrument in the world. There are studies, not only studies, but meta-analytic reviews with male and female samples. We have studies with indigenous populations, Hispanic, Asian. The research has been done on probation and parole clients with prisoners, inmates, even specialized groups such as sex offenders, male batterers, and mentally disordered offenders. In terms of prediction, there is data on predicting arrests, convictions, incarceration, even violent offending. In fact, when you look carefully at the research evidence, the LS instruments predict violent outcome as well as any specialized violence risk assessment scale. And of course, we have parole and probation violations and prison misconducts. I think for the practitioner, those of you who are working at the front lines with clients day in and day out, depending on the setting, it could be useful for you in preparing sentencing decisions. In many jurisdictions, LS instruments are the foundation of many pre-sentence reports. And what's interesting here is we have never advocated for using an LS instrument to encourage incarceration, to lock people up, to give the hardest response. In fact, because we emphasize the treatment integration with the LS instruments, our sentencing decisions should be informed, yes, by the risk of the offender, but also providing information to the courts on how that risk can be potentially managed in the community. And similarly, you can see the same kind of approach with release decisions from prisons, even mental health review boards. The LS instruments help you with intervention. It identifies the criminogenic needs that are vital for treatment planning. With the LS CMI, we have in it opportunities to outline a case management plan that is evidence-based and based on the risk-need assessment of that client, and allows you to monitor progress throughout the supervision period.